Welcome to healthU. 720 million people worldwide are on the edge of diabetes, but medical breakthroughs tell us that 58% of this risk can be reversed. Today we're sharing groundbreaking research just published in JAMA. What is prediabetes? Simply put, it's when your blood glucose levels have started to become abnormal but haven't reached the diabetes threshold yet. Think of your body like a car. Prediabetes is when the yellow warning light comes on, reminding you it's time to hit the brakes. The diagnostic criteria are actually quite clear. Fasting plasma glucose 100 to 125 milligrams per deciliter, 2-hour post-meal glucose 140 to 199 milligrams, or glycated hemoglobin HbA1c 5.7% to 6.4%. What do these numbers mean? Your pancreas is working hard, but it's starting to struggle. 1 in 3 American adults has prediabetes, and globally 720 million people face this problem. Even more alarming, 10% of Americans with prediabetes progress to diabetes each year. This isn't just a blood sugar issue. Research shows prediabetes increases mortality and cardiovascular disease risk. For every 10,000 person years, there are 7.36 additional deaths and 8.75 cardiovascular events. But the good news is, these risks are preventable. The Diabetes Prevention Program, DPP, is one of the most important prevention studies in medical history. This study followed 3,234 people with prediabetes for 21 years, with encouraging results. How powerful is lifestyle intervention? Research shows that through reasonable calorie restriction, at least 150 minutes of exercise per week, self-monitoring, and professional support, diabetes risk can be reduced by 58%. This effect prevented 6.2 cases of diabetes per 100 people over 3 years, and the benefits lasted 21 years. Especially for people over 60, lifestyle intervention effects are even more remarkable, reducing diabetes risk by 71%. This tells us it's never too late to start. What about medication? Metformin is currently the most important drug choice. It can reduce diabetes risk by 31%, preventing 3.2 cases per 100 people over 3 years. But metformin isn't equally effective for everyone. It works best for women with prior gestational diabetes, people under 60 with BMI over 35, those with fasting plasma glucose over 110, or HbA1c over 6.0%. Research teams from Johns Hopkins University, University of Colorado, Peking University People's Hospital, and University of Tennessee published this comprehensive review in JAMA, summarizing all the important evidence. Their conclusion is clear. Lifestyle intervention is more effective than metformin and should be the first-line treatment choice. The 2024 American Diabetes Association, ADA, guidelines specifically emphasize using a person-centered approach to care for prediabetes patients. This isn't just about treating disease, but helping each person regain control of their health. What does practical lifestyle intervention include? First is weight management, with a goal of at least 7% weight loss. If you weigh 80 kilograms, you need to lose 5.6 kilograms. For exercise, at least 150 minutes of moderate intensity activity per week. Something like brisk walking intensity is sufficient. Dietary control is also important, but you don't need to starve yourself. It's about learning to choose the right foods and controlling total calories. Self-monitoring helps you understand your progress, while professional support and encouragement provide motivation to continue. The major significance of this research is that it proves the medical principle that prevention is better than cure. Prediabetes isn't fate, but an opportunity for change. Every diagnosis is a turning point. Every successful intervention proves that humans can actively change the course of disease. From an economic perspective, early intervention can dramatically reduce future medical costs. A diabetes patient's lifetime medical expenses could reach hundreds of thousands, but prediabetes intervention costs are relatively much lower. More importantly, health is priceless. Avoiding the suffering caused by diabetic complications is invaluable. This research also opens a new era of precision preventive medicine. Different people need different treatment strategies. Some are suitable for lifestyle intervention, others need metformin added. Some may need more aggressive approaches. The key is finding the right plan for yourself. Finally, I want to remind everyone that prediabetes screening is very important. If you have a family history, are overweight, lack exercise, have high blood pressure, or are over 45, you should have regular blood glucose checks. Early detection and early intervention is the best prevention strategy. This JAMA-published research tells us that facing prediabetes, we're not helpless. Scientific evidence clearly shows that through lifestyle changes and appropriate medication, we can effectively prevent diabetes. Every prediabetes patient has the opportunity to change their destiny. This is the most precious gift modern preventive medicine gives us. Remember, health is in your own hands, and science shows us the way. Thank you for watching healthU. See you next time.